Well, October is Breast Cancer Awareness Month, and we often just assume it's a disease that only affects women. But men can get it too. Most people don't realize that men have breast tissue that can develop cancer. Oncologists Dr. Lesiba Kalo and Dr. Tula Ngobo, a breast surgeon, joins us to explain and discuss the impact that male breast cancer can have on our own families. Good afternoon and welcome to you. Thank you so much for joining us. Maybe let me start with you, Dr. Kalo, an oncologist. What are the very, very first signs that someone has breast cancer? A male has breast cancer.
A male cancer. Thank you. Generally, breast cancer, the attention is usually given to the female patients. However, males can also get the breast cancer. It's unfortunate that it's a forgotten gender, but the presentation is commonly almost the same. The only difference is that the breast is not as big as we see with females. It is quite a rare disease, so to speak. Of all the cancers in men, it actually contributes less than 1% of all the breast cancers. In breast cancer, actually, it's approximately about 1%. But we have seen in other countries like Uganda, it goes up to 5%, and Zambia can also go up to about 15%. So the signs that you usually see are almost the same. The common ones being, a lump in the breast. Any changes in the breast architecture, whether in the form of a lump or any skin changes around the breast, or any growth around the breast to the drainage to the armpits also. A discharge that comes out of the nipple, it can be a bloody discharge, and bloody discharge is quite sort of a danger sign to sensitize, our people that, that is not a normal discharge. So the presentation of the signs are almost similar with the women, which is that it is rare and not so much attention is given to the males, but it does happen. And the unfortunate part is that most of the men, because not so much attention is given to them in terms of early detection strategies like mammograms and ultrasounds and et cetera, so they tend to present very late. It's either in advanced disease or sometimes even in a metastatic setting whereby the cancer has already spread. So it is a cancer that must be taken serious. We know it's not that common, but irrespective of it not being common, it is quite a disease that needs a lot of attention.
Let me bring you in here as a surgeon, Dr. Ngobo. The common refrain is that men, first of all, don't check themselves for breast cancer, and when they do, they want to deny the fact that they may well have anything of the sort, seen as though there seems to be this sort of mental block against the fact that men can also get breast cancer. So what are the cases that you deal with? I mean, you must deal with extremely serious cases where, do males have to undergo mastectomies?
Yes. Now and again we see males, but it's very rare. Like Dr. Kalo said, in less than 1% of breast cancers, you find breast cancer only in less than 1% is only in males. The problem is that they tend to present late because the breast is very, very small. And they don't do mammograms. It's actually not advisable that men go for mammograms because of the rare cases of breast cancer in men. It's advisable that they actually just palpate themselves and feel if there's
for the lay men and women out there, palpate themselves, what does that mean?
It means just feeling your breasts. You must have a good idea of how your breasts feel like, have a good idea of how the skin looks like, and check if there are any changes. Things like nipple retraction, a bloody discharge, like Dr. Kalo has already said, those are things to take care of. But yes, unfortunately, because the breast is very small, by the time they present, you find that it may have infiltrated the chest wall or involved the skin, which already makes it a stage 4. In terms of, we call it a T4 because it's already involving the skin and the chest wall because there's minimal breast tissue.
Okay, so Doctor, we'll leave our conversation for the moment and hear from a number of men who didn't actually believe that it's possible to have breast cancer as a male. Let's see what the South African public said.
Yo, wow, I didn't even know something like that existed, bro. Yo, it's a first for me to hear. Like, I was hoping maybe you can tell me more about it, bro. Like, literally, I only know of females experiencing this breast cancer, so that's what it's famous for, or with whom, rather, it's famous. So not with males, so this is actually a first for me, so now I'm quite worried, because you never know. As males, we don't really check that out.
I've never ever heard of male breast cancer. I'm even still thinking it's a myth, so I'm too shocked to be scared for now that there's such a thing as male breast cancer.
I think I've heard of it, but I honestly can't tell you any more details than that.
No, I have not.
Male breast cancer. No. No.
I've heard about it, but I haven't done any research about it.
I have never heard of male breast cancer, but I've heard of prostate cancer.
I actually don't know a lot about male breast cancer. Obviously, the most of the instances are in females. So the truth of the matter is that I don't know much about male breast cancer.
Several times. I mean, it's about trying to really just look into this very crippling disease. It's often misunderstood, so dozens of times I've really heard about it. But I mean, I think there's also a least amount of information out there for males in particular to deal with it.
Well, I suppose this lies, therein lies the challenge when you address breast cancer. Not a lot of males even know that it's possible. And also, I suppose there's also this aspect of not wanting to accept that you would have a disease that's 99% of the time associated with a female. I mean, does that come into? Do you see that during your treatment of breast cancer in males as an oncologist? This sort of tigers don't cry problem that we have in other parts of our society, Doctor?
I think generally we as males, we're not that proactive, when it comes to taking care of our health. And having said that, breast cancer, it's very, very much common, with the females. So in that way, there's sort of some form of stigma to say, men, we don't get the breast cancer. And as to reiterate the point is that it is extremely rare. It doesn't get a lot of attention when it comes to platforms like breast cancer awareness. You can see even now, the media and everybody else, October, we put much emphasis on breast cancer in women, and rightfully so, because it affects about 30% or so of women versus the 1% or less than 1% of males. So, one, it doesn't get as much exposure. Two, we don't have exact early detection attention for our males, for our male patients.
We've spoken about the initial symptoms that you may get, Dr. Ngobo, but what are the risk factors commonly associated with male breast cancer?
The risk factors is a family history of breast cancer.
So that is obviously if your mother had breast cancer, your grandmother, or...
Yes, if there's a strong family history of breast cancer, actually male breast cancer is associated much more with a family history than the female breast cancer.
So but is there that crossover between, if your mother had breast cancer, you as a male are more susceptible to it?
Yes, there is, definitely. And generally, in males, breast cancer is more linked with your BRCA. It's BRCA2 in particular. There's the breast cancer gene, there's 1 and 2. It is more linked with the BRCA2 gene. But this happens in only about 15% of cases. So most are still sporadic. We cannot really explain them. Yeah. It's just only in 15% where there's a gene linkage to the cancer itself.
And besides the risk factor with the family history, Doctor, I mean, is there anything in particular that men do that you've seen, in the treatment of male breast cancer? Well, that seems a commonality when it comes to risk factors besides the one mentioned by Dr. Ngobo?
Well, commonly, as she has said, commonly is the genetic predisposition that you get with BRCA1. But there's other genetic diseases like what you call the Klinefelter syndrome. That syndrome basically is, because men have got an XY chromosome. So with that syndrome, you tend to have an XXY. So in that way, those kind of patients, they tend to be at the risk at least 10 to 15 folds to have the male breast cancer. However, having said that, there's also other risk factors that are associated, the age being one of them. The older you get, the higher the risk of you getting them. There's been other factors like associated with cirrhosis, chronic alcoholism, infections like schistosomiasis.
So just to reiterate, alcoholism can be associated with male breast cancer.
There have been studies that have shown that other factors like the cirrhosis, which cirrhosis, the other cause might be alcoholism, infections like schistosomiasis. There's a controversial one of whether gynecomastia, especially the swelling of your breasts, that is being associated with the cause. But that is very controversial because there's never been any data to confirm for sure if there's a causative effect between gynecomastia and male breast cancer.
I have another question on how perhaps male breast cancer relates to male obesity, but we'll get to that in a moment. We've got some more vox pops of South Africans responding to the prevalence of male breast cancer. If you just joined us, third week of the month that's dedicated to raising awareness around cancer, specifically focuses on male breast cancer awareness. Let's see what South Africa thinks about the disease.
Yes. Yeah, Lillian Dube, when she talk about it on television, that's it. I don't know anything about it, but I heard about it.
Apparently, breast cancer doesn't discriminate whether you're male or female. Chances are you might have it. So it's important that everyone, irrespective of your gender, you need to go and check if you have it or not, because that will help you with starting your treatment early. That's if you got it. Then if you don't, then you'll know exactly what to do going forward. But it's something that was new to me. But yeah, at least I've learned something going forward. Obviously, I will know exactly what to do if there's something that I feel as if it's out of ordinary from my breast or muscles that I have.
Only heard about male breast cancer in recent months, but prior to that, because we used to associate it with women.
It's the first time that I've even heard about male breast cancer. I think the worst I know of is prostate cancer when it comes to males. So no, I've never heard of that.
Yes, I have. I've read about it. Yes.
Yes, male breast cancer is, the female and the male hormones, the difference is very small. So the activations of the breast on a male hormone can also have cancer. We all both humans, only that our breasts are less active. But in terms of hormonal difference, we've got the same hormones, and the difference is very small.
Well, that's along among South Africans responding to the prevalence of male breast cancer. We're in conversation with oncologist Dr. Lesiba Kalo, as well as Dr. Tula Ngobo, a surgeon when it comes to male breast cancer. We've got MacDonald Gwaza on the line. He's called into 011-759-6340. Join the conversation if you'd like. MacDonald, good afternoon and welcome to ENCA Now. You have a question for the good doctors.
Hello, good morning, afternoon, how are you, sir?
Yes, MacDonald, go ahead.
Yes, my question was supposed to say to that, I'm 25 years old now, so I was having, I'm so, it's my first time hearing about this, so I'm having some pains on my chest, so I was so surprised to say that, how does that thing get you when you are young, and how does the symptoms, how did it, previous of my one, there was one of my family who had that thing, so I want you guys to know, okay, as long as I saw that problem is, so what is the nearest solution for me?
Okay, I'm not too sure if you picked up that immediately, but MacDonald says he's been watching the program, first time that he's actually heard of this. He's got a couple of lumps on his chest. What's the first point of call? Do you go to the local clinic? Would you suggest that he maybe go to a big government hospital?
At his age, he said he's less than the age.
Yeah,
of
he's 25.
Age is one of the most important factors when it comes to breast cancer. It is very rare for him to have breast cancer, at least below the age of 20, below the age of 25. However, any lump needs to be investigated, whether you're male or female. So I'll suggest to him that he goes to his nearest clinic, get a referral. It's either to a surgeon or a breast surgeon specifically, depending what kind of insurance he's got access to. So yes, that lump needs to be investigated. And if I missed it, I'm not sure if I missed it. I think he mentioned something that there's somebody in his family with breast cancer. I'm not sure if it's breast cancer or cancer.
Yeah, indeed.
So
I think it was just cancer, it wasn't breast cancer particularly.
Yes. So we're not sure what kind of cancer of it, but however, we will advise him to at least go to the nearest clinic or the nearest hospital to get it checked.
And then, Dr. Ngombo, you said that the easiest way for us to check is there any consistency that you're looking for? If a male wants to investigate his own and examine his own breast, what's the sort of consistency that you're looking for? Is it a lump in very close to the nipple? What are the details?
Most of them are actually located under the areola, so close to the nipple. But anywhere around the area of the breast, any lump should worry you, and you should consult and have it checked out. And males do get mammograms. It's just that mammograms are only done when you have a symptom. So he needs to have a mammogram done. That is done together with a sonar. And if there are any suspicious masses seen on mammogram, those have to be biopsied, meaning a tissue must be taken and investigated to check whether it's a cancer or not.
So we've also got another caller there, Lindy. Lindy, good afternoon and welcome to ENCA Now. You want to ask the good doctors a question about male breast cancer?
Hi, yes, good afternoon.
Yes, good afternoon to you,
I just need to ask a question on behalf of my brother. He's 25 and he has a large lump behind his nipple area. It's painful and his left breast is quite swollen, and the pain is more painful towards his underarm area. He says that he did have it looked at, and he did have a sonar probably about 2 years ago, but he was told it was nothing that he should worry about.
Doctors?
If the lump persists, I suggest that he consults again. You can get benign tumors. You can get lipomas. You can get breast abscesses. Initially, when she described it, I thought it's a breast abscess, but then a breast abscess should rupture or be drained, and the symptoms should go away completely. So anything that persists, even a dermatitis, actually, because you can have something that looks like just a skin infection or a skin condition that we call, dermatologists call dermatitis. That can also be a cancer hiding as a skin infection.
What is the easiest way to tell between first signs of cancer and things like the things that you just mentioned, breast abscess, blocked pore, dermatitis, anything of the sort? I mean, besides looking at yourself, examining, is it always a good idea to, if you're unsure, immediately go seek medical help and get a scan?
Definitely, I would say so. If you are not sure, and anything that persists, because a dermatitis, you should be able to apply something and it goes away. An abscess in a few days should rupture, or it should be drained by a surgeon, and it should disappear. So anything that persists should make you worried, and you should seek help regarding that.
All right. Well, I wanted to ask how this relates to male obesity as well, because you said that is a less risk of breast cancer among males because the breast is so small. However, we do have one of the highest rates of obesity in South Africa. Does the prevalence of breast cancer increase the more obese a patient is? We do know that South African men that do suffer from obesity do carry a fair amount of extra weight and fat in their belly and chest area.
Obesity, it's a lifestyle challenge, and obesity does not only affect cancer. It affects, a broad spectrum of all the cancer. It's a very common risk factor when it comes to, very common cancer, prostate, breast, even in females. So obesity is associated with other lifestyle diseases like your hypertension, your diabetes, and everything else. So obesity, yes, it is one of the risk factors that is associated with breast cancer, not only with males but also with the females also, because about 20-25% of breast cancer is associated with lack of physical activity, and lack of physical activity predisposes you to obesity, and obesity predisposes you to hormonal imbalances, and those hormonal imbalances, especially what we call the estrogen, predisposes you to diseases such as breast cancer.
And in your experience of treating this disease, Dr. Ngobo, have you experienced that men that suffer from obesity are far more at risk in terms of the cases that you've dealt with yourself?
Well, I would say yes, but like I said, there are very few cases that we deal with that we say it's a very rare cancer. But just other things that we must remind ourselves is that you also get it in all conditions where estrogen is high for whatever reason. So somebody who's had an orchitis, which is an inflammation in the testes, somebody who's had trauma to the testes, radiation, anything that increases your estrogen predisposes. And even the liver affectation, where in Africa, for instance, in Tanzania, they report that 6% of men, it happens about 6% of breast cases. It happens in males. And in these situations, you find that there are liver infections, and that affects the hormones, and you end up with an estrogen drive.
All right, we have Zakes on the line. If you want to join the conversation on ENCN now, 011-759-6340. Zakes, you have a question for the good doctors.
Okay, yes. Thank you, Nick, and the panel there. I think we're all okay. Yeah, my question is now about this is the month of breast cancer for males. And now having watching on the line there, from the TV, I see most of we guys, men in particular, are really not aware that we have that. Now, what effectiveness is going to be done for us men to can be aware and make tests and so? Because the other issue is that, we as men are very much ignorant and in denial to make tests when coming to any disease or illnesses. So now the challenge that we are having in addressing that issue and going to males, what sort of campaign is going to be done in that regard? Thank you.
Do you know of any campaigns, public, private sector? I understand that there is the Pink Drive. We had the Pink Drive on the ENCA now last week, Saturday. There is a component of male breast cancer. But do you think the public sector is doing enough to raise awareness of this particular cancer?
I think it is platforms like this whereby we can increase awareness and sensitize our communities out there that cancers like breast cancer in males are actually, they do happen. As rare as they occur, but they do happen. So, yes, I think it's about time for us to accelerate on strategies to even give more attention to the males, because as I've said, I think most of the attention when we talk about breast cancer awareness campaigns, we put more emphasis on the females. Yes, and I would want to agree that yes, when we go out there to spread the message about breast cancer awareness, we should also include the male counterparts.
Now we have another question, Daniel on the line. If you want to join the conversation on the NCA now, 011-759-6340. Daniel?
Good afternoon to you and the two doctors on the TV. Thank you very much for giving me the opportunity to speak to you. My wife has both her breasts removed, my apologies. And we're having a hell of a trouble with non-fit laboratories, blood testers, and even the doctor. Over 1,000 granted a visit, and we're having a lot of trouble. My wife worked at the Reserve Bank for 20 years. We even left our pension. If you have a good medical aid, we have got Concmed Plus. But after the operations and everything, we've got no more medical debt. She's registered with C509 as a cancer patient. But the oncology people tell me, no, they can't pay all these things, they can't pay all these. We get calls from people, they want their money, like Lancet and all that. Is there anything the doctor can tell us? What we can do?
It is quite a difficult situation to be in when your medical aid runs dry and when you're facing such a difficult predicament as cancer. But I mean, what can you actually do?
It all depends on what plan is you on with the medical insurance. Because there's different spheres. You know, there's the basic plan, there's comprehensive plans. So different plans cover different oncological interventions. For example, there will be plans that will say we do CT scans, or we only do mammograms, we only do ultrasound. So I'll advise him to check what kind of a plan he's on, and then based on that, then he can have more information to say what does he qualify for. And then after knowing what he qualifies for, and then he can be able to make a follow-up on that.
Oh, I believe we have another call. Remember, last chance to join us on ENCA now, joining the conversation, 0117596340. Curtis, are you there? Curtis, are you with us?
Yes, Nicholas, good day.
Please go ahead.
Good day to the doctors. I just wanted to check. I once had a pain on my right nipple. It was there for 3 days. It was very sore, and then it moved from my right nipple to my left one, and it was like 2 days after that I went through a period of prayer and fasting for 15 days, where I never ate anything. I was just drinking water and tea, and after that 15 days, it disappeared and it never came. It is now 9 months that I don't have it, but later on my little son, which is 12 years old, also experienced the same pain on his nipple, on his left nipple, and it was exactly the same like mine. But it also then later disappeared, and it never gave him a problem. So I just wanted to check with the doctors, is it something that should I be scared of, or go and consult and check?
Doctor?
I don't think he should worry if the pain has gone away and he has no symptoms currently. But if the symptoms come back, he'll have to consult. And like I said, you don't do routine mammograms in males like we do in women.
Only when there's serious indications.
Only when there's a symptom. But coming to the boy who's 12, it may be just puberty, because usually you get a bit of pain before, you do get a lump forming in puberty as boys develop. That also goes away, but it's nothing to worry about. But again, if the symptoms persist and don't disappear, they have to consult and get an opinion.
Okay, so before we wrap up our conversation, it's been fascinating chatting to you, Dr. Lesiba Kalo and Dr. Thule Ngobo. The absolute basics that men need to remember now is self-examine, but also don't dismiss pains for too long, especially if they persist. Is that right?
Yes.
Yes, I would agree to say, I think we need to start taking care of ourselves more. If there's any symptoms that persist, like Dr. Ngobo says, to say, there are so many things that can cause the symptoms that we've discussed. However, the persistence and the duration of those symptoms warrants one to have a concern to say, if these symptoms don't disappear, let me get checked.
We have one more caller, I'm told. It'll be the last caller for this discussion. Kamo, good afternoon and welcome to ENCA now. Kamo, good afternoon and welcome to ENCA now.
Good afternoon to you.
Hi, yes, Kamo, may we ask you to please turn down your TV in the background? Hi, yes, Kamo, may we ask you to please turn down your TV in the background? Hi, yes, Kamo, we're going to need to come back to Kamo. It's a very, very difficult disease to try and treat if you don't have medical aid. However, a lot has been left to be desired when it comes to the public healthcare system. There are certain instances where there's flashes of excellence and brilliance, especially in the Gauteng province, where there's various oncologists that have been lauded for their work in the public sector itself. What is your thoughts there? I mean, what is your advice to South Africans that A, don't have a medical aid, or B, have a medical aid that's run out but are facing such a serious disease like cancer?
Yeah, in the South African healthcare, we do have 68 to 70%, whereby our healthcare system is, purely government-funded model, and you look at the number of patients that the Department of Health has to take care of. If you're looking at a population of 57 million, and that means the government has to take care close to 40 million people. The fight for resources, the accessibility to resources, tend to be compromised. However, I think the Department of Health has done a lot, to increase accessibility for our people, our patients, from the primary healthcare level, because the primary healthcare, that is our first point of entry for any disease. Hence we go around the country training our primary healthcare doctors, for primary healthcare nurses, to sensitize them to specific diseases, how they look for them, common ones at least, the lifestyle diseases, cancer and breast cancer included. So yes, I think there is access there. It's just that the information needs to be spread that if people have got problems, how do they get hold of their clinics, their district hospitals, and sometimes even their public hospitals, whether secondary or tertiary hospitals. But when it comes to people with private insurance, I think, yes, there's plans that people are involved with for the medical aid point of view. Yes, I think our patients should understand that their medical aid gives them access to certain services and not all the services. So the sooner you understand what your medical aid gives you access to, the better to understand how to go about it if you encounter any problems.
Okay, I'm told the Kamo is back on the line. Kamo, you have a question for the good doctors.
Yes, thank you for having me. My question is, I have seen in women who have breast cancer, when they, for instance, have to do a mastectomy or remove the one breast that's affected, sometimes you find that maybe with time it will spread to the other breast. How frequent is it in males that you can get spread to the other breast and the person now has to have both breasts? And would it help, for instance, just to, after having diagnosed it on the one breast, to, from the onset, remove the other breast as well as a measure of trying to curb the possible spread of the disease to the other side?
Dr. Ngobo, your thoughts?
It's very rare. In females, there's about a 10% chance of having a cancer on the other side if you have a lobular cancer. The most common cancers are a lobular, which develops in the lobules, and a ductal, which develops in the ducts. So because males don't have a real form breast, they don't really have lobules and acini. But with estrogen stimulation, you can then get lobular cancer developing, but it's very, very rare. So I wouldn't say it's necessary. But in females, if you have a lobular cancer, you have an option. We tell you that there's a chance that you can have a cancer on the other side, a 10% chance, so you decide whether you'd like to have a prophylactic mastectomy on the other side. In males, I would say no, but again, we must just remember those that have a family history and carry the BRCA genes, then the chances of them having cancer is higher. And in those cases, a prophylactic mastectomy can be advised. Again, we just draw lessons from the female because we haven't seen much breast cancer. There haven't been much studies in male for us to be guided as to which direction to follow.
All right, we are told that we've got one more caller on the line. Kamogelo is joining ENCA now. Kamogelo, you have a question, parting shot for the good doctors.
Yeah, yes, I actually have a comment. I'd like to thank ENCA for actually making us aware to breast cancer, because if I wasn't actually watching ENCA, I was not gonna watch about. I was not gonna know about male breast cancer. So now what I'm gonna do is actually tweet about it, tell my brothers and my community about it, and actually make them aware. And I'd like to actually comment about the two doctors and thanking them as well, coming to the show and actually making us aware about male breast cancer. Yes.
Well, thank you very much for the enthusiasm. Kamogelo joining us on the line there. It is something at the end of the day society needs to take a little bit more serious. At the end of the day, though, with its being such a low prevalence, what are the main cancers that men need to look out for? I mean, the obvious one is, of course, prostate cancer. Is there any others that you would say immediately South African men need to watch out for based on our prevalence rates?
Yeah. In South Africa, like you already said, about 20% will be the prostate cancer. That followed by esophageal cancer, the cancer of the esophagus, followed by cancer of the lung, and most commonly the cancer of the colon. Other cancers are still there, but they are rare. Cancers like your skin cancers, most commonly what we call the melanoma. You have your leukemias of this world, you have the lymphomas of this world. But the big five are basically your prostate, your colon, your esophagus, and also the skin cancers.
Now, I wouldn't be worth my salt as a journalist if I didn't, if I had the opportunity of an oncologist sitting next to a surgeon and didn't ask this question. When it comes to cancer, I've known in my own family, people that I've known through acquaintances and other relatives as well, there's this quandary that people find themselves. Many say it's a fork in the road when it comes to cancer. Head for surgery or try with chemotherapy and oncology. It's maybe a layman's ignorance, as it were, but I mean, what's the first point of call? I'll let you answer first. I mean, Dr. Ngobo, do you think that surgery is the best way to get rid of the cancer, or would it just completely depend on the case?
Surgery is the only way that you can completely cure a cancer. So a cancer can be cured, particularly, except for certain cancers that can go into remission, like your lymphomas and your leukemias. But coming to breast cancer, the only way to cure is when the cancer can be completely removed. But chemotherapy is indicated. For instance, if the cancer is already very big by the time we diagnose it, and for instance, it's already in the armpits, in the lymph nodes, we worry that it's on its way to other organs. And what really kills you is the spread to other organs. For instance, if you spread to your liver or your lungs, that is what will kill you. And it's better to have chemo first to downgrade the tumor, and then surgery, and then followed by chemo.
So they work hand in hand?
Yeah,
hand
like
in glove.
a sandwich.
Okay, yes. Good to hear. Maybe a final word from you as an oncologist, Dr. Kalo. I mean, is that a fair assessment, or would you advise otherwise? Stay away from the knife?
Well, there's different modalities of treating a cancer, surgery being one of them, chemotherapy being another, what you call radiation, and nowadays there's a route what you call the targeted therapy. Each and every one modality has got its own indication, not only the indication but the timing. Some breast cancers, maybe they're too advanced, they'll need chemotherapy first to be downsized, so that they can be able to cut. But other ones, they cut first, and then you give chemotherapy and radiation to prevent recurrence. But however, that is entirely dependent on the stage of the cancer.
Hippocratically diplomatic, as it were. We thank you very much for your time, Dr. Lesivo Kalo and Dr. Thuli Ngobo, chatting to us about the scourge of cancer in South African society, and particularly male breast cancer. Thank you very much for the engaging phone calls. Unfortunately, we couldn't get to all of them, but as the good doctor said, best prevention instead of cure, and always check yourself as a male for the prevalence of breast cancer itself. More indications more information can be found on various health websites across the globe as well. That's where we leave it for today. For me, my colleague Anli Hutton is standing by to take over. It's been a pleasure having my afternoon with you on ENCA Now.